Hello, everybody. This is Dr. Kamel and a new video or a new topic for the preparation for BT license exams. Um, if you didn't see any of my videos before, I work as associate professor of physical therapy in the United States, and I'm a licensed physical therapist in the United States, in the UK, and in Egypt as well. I have got my PhD from University of Nottingham in the UK. So let's go for today's question. A 58-year-old patient with a history of gastroesophageal reflux disease or GERD reports frequent heartburn after meals, especially during physical therapy sessions scheduled in the afternoon. The therapist plans to include supine therapeutic exercise as part of the treatment program. Which of the following recommendations is most appropriate to reduce reflux symptoms during therapy? We have a patient having GERD, gastroesophageal reflux disease, and especially this is increasing in the afternoon, and you are planning to do some exercise, some activities for this patient, but supine lying position, it would be part of these activities. So how we can follow some rules or recommendation in order to reduce this reflux symptoms during therapy. Number one, sit upright. Asking the patient to sit upright for at least 10 minutes after a meal. Lie on the right side before performing exercise. Perform head lifting exercise in the upright position. Schedule activities that require supine position before a meal. And these are the four options which we have. Which one is the correct one? Number four. Schedule activities that require supine position before a meal. So GERD or gastroesophageal reflux disease, let's understand some information about GERD. Occurs when gastric content reflux into the esophagus during a lower esophageal sphincter incompetence. This is the esophagus and it goes into stomach. Okay. And we have here the lower esophageal sphincter. Sometimes this lower esophageal sphincter will be incompetent, and this means that the acidity of the stomach, which is too much acidity, we have a very lower pH, will be regurgitating into the esophagus here, which should not happen because it should be one way street. Food will go from the esophagus down to the stomach, and this acidity should not go back into the esophagus. The lining of the stomach is equipped and with certain properties which can resist this excessive acidity and low pH, but the inner walls of the esophagus is not the same. So if you have regurg of this acidic reflux into the esophagus, it will cause problems, metaplasia, dysplasia, cancer of the lower part of the esophagus, and so on. So this is a mechanism basically of esophagus of GERD. So this reflux is worsened by full stomach, supine lying position, so the patient doing exercise from supine lying position, bending forward, increase in intra-abdominal pressure, or right side lying. These are the things which might increase this reflux problem or reflux sensation. Okay, so what we will do, schedule activities that require supine position before a meal. So exercise that require a supine position should be performed before eating so that the stomach is relatively empty. Okay. The recommended time to remain upright after a meal is 3 hours, not 10 minutes. Okay, like in one of the options over there. Head lifting in supine is a recommended exercise to strengthen the upper esophageal sphincter muscle. So it is not the solution for the problem here because we have a problem with the lower esophageal sphincter. If performed in upright, the head falls into gravity and the exercise is no longer resistive. Okay, so again, this option is not right. Patient should lie on the left side to reduce reflux, not on the right side. Okay, because lying on the right side makes it easier for acid to flow into the esophagus, since the lower esophageal bends to the left, and this straighten out with right side lying. So again, we would recommend left side lying, not right side lying. Why? Okay, because since the lower esophageal bends to the left, and again this straighten out with right side lying. So again, the incorrect options: sit upright for at least 10 minutes. We said that is not enough. 10 minutes is not enough. Upright posture does help. So 10 minutes is insufficient. And in some evidence they said at least 30 to 60 minutes, and in other textbooks saying at least 3 hours after eating. So it is partially correct answer, but it is not the recommended duration. Lie on the right side before performing exercise. Again, right side will worsen the reflux. Why? Because the stomach will empty more slowly, and acid pools near the lower esophageal reflux, or the other explanation which we just said a few minutes before. So if side lying is recommended, then left side lying. Okay. Perform head lifting exercise in upright position, head lifting exercise, or they call it shaker exercise. It is typically done in supine. Why? To strengthen the suprahyoid muscles for swallowing disorder, not GERD management. Okay, so mainly again to strengthen the suprahyoid muscles for swallowing disorders, not for GERD. Okay, and then it will not help in any way. So, so what clinical points we can take home from this? Supine position increases reflux. Why? Due to gravity loss, increase in intra-abdominal pressure, reduce esophageal clearance. So, performing supine exercise before meals when the stomach is empty minimize reflux risk. Okay, and for GERD patients, again, schedule supine activities before meals. Keep patient upright 30 to 60 minutes post meal. Avoid right side lying. Avoid forward bending after meals. Elevate head of bed 6 to 8 inches for sleep. If you would like to join my BT license preparation course, especially for those people applying for the USA, Canada, or Australia, or if you would like to apply and join the post-professional or transitional DBT at University of Montana in the US, which is provided at a reduced discounted rate, and we can help you to enroll. You can send us WhatsApp message on 001442248720 or 00201027743702, and we will send you the details for the course details for the DBT program and degree. Thank you for watching. Please share with your colleagues and subscribe to the channel if you like. Thanks. See you soon.